Kate, it is very good to see you. Today we are breaking down Medicare basics and misconceptions. There are so many different enrollment periods with Medicare, and there are penalties if you miss your enrollment period. October 15th, which is just around the corner, kicks off the annual election period that runs until December 7th. So let's get into it. When does Medicare start, and what deadlines do I need to keep in mind?
Hi, Erin. Sure. So let's dive right in. So Medicare eligibility typically starts when you turn 65. So there's a 7-month election period, and it's called your initial election period. So you have 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday to enroll in Medicare. Now, if you're still working, you can keep your employer plan as long as it's active coverage and not COBRA coverage. If you stay on that coverage, once you come off, you're going to use something called your special election period in order to enroll in Medicare. If you miss both your initial election period and your special election period, you could incur penalties or late enrollment penalties for not enrolling when you were first eligible. You are able to enroll during Medicare's open enrollment period each year that begins on January 1st and runs through March 31st. And there's also another election period during the year, and it's every year that you referenced before. It's your annual election period. That's going to apply only to Medicare Advantage plans as well as prescription drug plans, but it's really important to use that enrollment period in order to review your plans at that time.
Right. Okay. I hope everybody had their pens and a calendar out. A lot to keep in mind. So now let's hop into Medicare though, Kate, because we're all familiar with it. There are four parts: A, B, C, D. Let's talk it through.
Sure. So the first thing is your Part A coverage. That's going to be your hospital coverage. It's going to cover your inpatient, your skilled nursing, as well as your hospice coverage and the things that you see there on the screen, right? Your Part A coverage is typically, it's going to come with a $0 premium for most people as long as you've worked 40 quarters or 10 years and paid your Medicare taxes, right? So the next thing is your Part B. That's going to be your medical coverage. And that's going to include outpatient coverage, doctor's visits, your preventative care, durable medical equipment, and lab work. That does come with a premium. Everybody pays a premium. The standard premium is $174.70 this year, and it goes up each year with inflation, cost of living, right? On January 1st.
Mhm.
It is income based, so if you are a high income earner, you're not going to pay that standard premium. You're going to pay more.
Yeah, we talk a lot about that as well. All right, before we talk about C, I do want to talk through Part D. What do we need to know about Part D?
Sure. Part D stands for drug. It's your prescription drug coverage. It is going to lower your prescription drug costs if you enroll in a prescription drug plan. If you don't enroll in a prescription drug plan, again, you're going to have that late enrollment penalty. So if you're someone who says, hey, I don't have any prescription drugs right now, I don't need that. When you do finally need it and you enroll in it, you're going to have a late enrollment penalty that's applied to your monthly premium for the rest of your life. So it's really important, especially with the rising cost of prescriptions, to enroll in a prescription drug plan, in my opinion.
For the rest of your life.
That's right.
Worth repeating. That's a big one. Okay, though, let's share some good news because after the Inflation Reduction Act, there's some good news about Part D. Tell us about that.
Sure. So beginning in 2025, the Inflation Reduction Act has significantly impacted the amount that Medicare beneficiaries are going to be paying for their prescriptions. For one thing, there will no longer be a Medicare donut hole, so we don't even have to talk about what that was anymore. But there's also now a cap or a max out of pocket on what you'll pay for your prescription drug costs. So that's going to be $2,000 beginning in 2025. And that's really important, especially for people who are paying a ton of out of pocket costs for prescription drugs.
Yeah, that is a really big deal. Okay, so now let's circle back and talk about Part C, please. Some say you need Part C, which is the Advantage plan. Others say you don't.
Sure. So Medicare Part C is your Advantage plan, as you said, and it's an alternative to original Medicare, and it bundles Part A, Part B and Part D all together. It also adds in some special benefits that include, free gym memberships, hearing, dental, vision, bundles them all together under a private insurance company. So you're going to take your red, white, and blue card, put that away in a safe, and you'll have one card, one insurer that's going to administer everything for you. It's also important to note that with a Part C plan, you are network bound. So it's going to be a plan like a PPO where you have in and out of network access, or an HMO where you only have in-network access. But regardless, you are bound by a network, and you'll pay more if you go out of network, or you won't be able to go out of network at all in the case, which is the case with an HMO.
Okay. So what is the primary difference between using a Medicare supplement and a Medicare Advantage plan?
Sure. So Medigap works alongside Original Medicare. So your A and B, which is Original Medicare, will pay first, and then your Medicare supplement or Medigap plan is going to pay second. So I think the primary difference between Medigap and Medicare Advantage is the fact that with a Medigap plan, there is no network. You can go to any doctor within the United States who accepts Medicare, and your plan will be accepted. And again, you heard me say any doctor within the United States. That means it's not network bound. And also, you're going to know exactly what you're paying each month in premium, and the out-of-pocket costs are minimum. We've already touched on the Medicare Advantage or Part C plans, but just as a refresher, the Part C plans, you're going to pay lower in premium, higher out-of-pocket costs, and you're bound by networks.
Caitlin, this is so much to consider. How do you help determine what a client needs?
Sure. So it really comes down to the individual, and there's a couple of considerations. We're talking budget, your health needs, lifestyle, and your preferred provider. So when I mentioned budget, that's the Medigap plans. You know what you're paying in premium. You're going to have low or no out-of-pocket costs as you go. Medicare Advantage, your $0 premiums, but you can get hit with high out-of-pocket costs if you have a lot of usage. Then when I talk about lifestyle, referencing, so if you either live in two states, like a lot of people I know in New Jersey who live in New Jersey and Florida, a Medigap plan might be the best option for you because there is no network. You can go to your doctors in Florida, you can go to your doctors in New Jersey, right? Also, it's good for people with chronic conditions, so health needs. So if you have chronic conditions or you see a lot of specialists, Medigap plans are probably the way to go because, again, no networks. And then finally, when I'm talking about preferred providers, so if you have doctors that you've been with for years and you want to make sure that your plan covers them, it's really super important if you're in a Medicare Advantage plan to check those networks, make sure those doctors and hospitals are in, so you can still remain as patients with them.
Clearly, no cookie cutter answer here. Kate, if somebody would like to, again, talk this through with you, figure out what is best for them, what's the best way to reach you?
Absolutely. So you can reach us at professionalplanningservices.com. You can visit us on the website, make an appointment on the website. Super easy to schedule there. You can also give us a call at 732-302-1810. We're always happy to help. And you can email me at caitlin@professionalplanningservices.com.
Great. Again, thank you so much for your time today. This was really helpful to talk it all through.
Thanks, Erin. Always nice to see you.